Hi, I'm Rosie.
And I'm Joe.
And we're chiropractors here at Total Health West Berkshire. So one of the questions that we get asked a lot is, how much treatment do I need, or am I going to need? So we thought we'd have a conversation about it, because we can't give generally a number, can we?
No, it doesn't really work like
It's
that.
really hard to say, right, you will need 2, and you will need 5, and you will need, 90.
Yeah.
I don't think I've got anyone to do. Maybe. I've seen 90 times if I've been seeing them for 10 years or something.
Yeah.
Because some patients you do see for a long time. So I tend to find, don't you, that you have patients who need a little bit of treatment.
Yeah.
Like they might have hurt themselves and they need some treatment. I don't know, they picked up a fridge when they were moving or something daft like that, and they've hurt their back and they need some treatment, and then the problem will be sorted, more or less.
Yeah, I think most patients will broadly fit into somebody who's got something that's acute, that's happened really quickly. They're experiencing potentially pain in the back or the neck for the first time. And then other patients who will have more of a chronic problem. It might be you've had headaches for years. It might be you've had low back pain for years. Sometimes it will come and go. Sometimes it will be constant. And depending on what your scenario is, or depending on typically what sort of treatment plan you'll need.
And when we're saying a little bit of treatment, I'm talking about 5 or 6 treatments.
Yep.
To us is a little bit of treatment. Someone who has had a problem for a long time, or someone who has a treatment and then gets better but finds that actually if they have treatment every 4, 6 or 8 weeks, they feel much better. Like they don't have to have it. Their world won't end, will it, necessarily, if they don't have it, but they feel like they move it easier, they're less achy at the end of the day, they can get through their day better, maybe they can exercise more or play with their kids more, so they come and see us regularly, and they're the patients that I might have seen for 10 years on and off during that time.
Yeah.
And also you have those patients who I might see 3 or 4 times, and then you won't see them for 2 years, and then they come back again, because then they've hurt themselves again or something's happened.
Yeah, I think for those sort of patients we usually call on-call.
So there's a thing that you see a chiropractor and you have to see them for the rest of your life.
Yeah.
And you totally don't. So what we generally do is we do a new patient appointment, don't we? We do a full assessment. And then after that time, and we'll agree a course of treatment, which might be 5 treatments, 6 treatments, 10 treatments, depending on, if you've got a fully blown disc, that's not going to go in 6 treatments, is it?
Not a chance.
We would like to be that magical.
The occasional magic fix will be a one crack, but it's very, very rare.
Usually you have to be 21 and hurt your back playing tennis, then you adjust them once and they leap off the bench, you never see them again.
Mm-hmm.
But if you've got something more long term, it's going to take a course of treatment. And when we've done what we thought would be our initial course of treatment, we then do a review appointment, don't we?
Yeah, after however many sessions we estimate it's going to be.
Let's say 6, because that's a nice easy number. Then we say, what do you want to do? Do you want to have some more treatment? Are you better? How much better are you? And some people want to do more treatment, don't they, and carry on.
Yeah.
And usually less frequently than what we've seen them in the past.
Yeah, and I think at that point we usually recommend cutting down the appointment schedule by half at a time, purely from if you withdraw care all at once after you've been seeing twice a week, then some of those sensations or tightness or feelings can start to creep back in.
Yeah, so withdraw it, and each time we see people do you want to carry on with treatment? Do you want to stop? And then people can make a decision. So there's never any pressure to keep coming in, but people tend to come back if they feel that they're doing well and there's a benefit to them, because no one's going to do something that doesn't benefit them. And I remember I've had a conversation with a patient, do you still want to keep coming in? is it benefiting you? And they've gone, quite bluntly, well, I wouldn't be here if it wasn't helping, would I? And you're like, true. That's very true. One thing I thought I might mention, because we use... People in healthcare tend to use words, so we've used acute and chronic, haven't we?
Yep.
Now, to people in the healthcare professions, acute is a period of time.
Yep.
Chronic is a period of time. It's not how bad it is. So acute just means less than 6 weeks.
Yeah. And if we're talking about if you're talking about how severe something is, that's the severity goes along with something. So you could have an acute condition that is particularly severe. Discs can often be quite like that. Yeah. And you can have a chronic problem which is fairly mild. It's just that kind of lingering little bit of back pain that you get every now and then, which is really common for people who, work behind a desk or have got a physical job. Just the regular aches and pains, and we would call it often mechanical pain that people get day to day.
Yeah, and also what we always do with patients is we want to help improve I don't know, like if you like the lifestyle around you. And obviously, there's limits to what we can do with that. But what we can do is things like posture. So we look at your desk posture. We talk about orthotics sometimes. So you can check out our video on that. And we might talk about some exercises that people can do throughout their day to sort of stretch and strengthen.
Yep.
So that we can try and make sure that you've got a program to help your body get better. So it's not reliant just on us treating you.
Yeah, I think typically combining lifestyle, a bit of exercise, and manual therapy tends to get the best results.
Yeah. So I hope that's answered questions on what happens if you come, or how much treatment you need, and a little bit about how we treat patients. So if you've got any questions or you'd like to book a chiro chat, then have a look at contact us on the bottom below. We'll be happy to talk to you.
Yeah.